Vitamin B12. It's small, it's powerful, and it plays a huge role in keeping your brain sharp, your body energized, and your nerves firing like a well-tuned machine. But here's the surprising part. Even though B12 is found in plenty of foods, deficiency is shockingly common. And many people don't even realize they have it until symptoms start creeping in. Whether you're in your golden years, expecting a baby, or even a young adult, low B12 can quietly sabotage your health. And today, we're breaking down the most common signs and symptoms, so you can spot the warning lights before things get serious. Why vitamin B12 matters? Vitamin B12 is essential for three main things. DNA synthesis. Without it, your cells can't divide and grow normally. Energy production. It's a key player in turning food into usable fuel. Nervous system health. It helps protect and repair your nerve cells. But here's the catch. As we age, our ability to absorb B12 from food naturally declines. That's why older adults are at a higher risk. But they're not alone. Pregnant women, children, and even healthy young adults can run low due to poor diet, digestive issues, or certain medications that deplete B12. Symptom number 1, weakness, fatigue, and lightheadedness. Our cells rely on B12 to function. Without it, your body can't make enough healthy red blood cells, leading to megaloblastic anemia, a condition where large, abnormal red blood cells form and oxygen delivery to your tissues suffers. The result? You feel weak, drained, and sometimes dizzy. Now, fatigue is common and can have many causes, but if it's persistent and paired with other symptoms on this list, B12 might be the culprit. Symptom number 2, a red, painful tongue. If your tongue looks beefy red, feels sore, or burns when you eat certain foods, you might have Hunter's glossitis, an early warning sign of B12 deficiency. On closer oral exam, you might also see stomatitis, mouth inflammation, dry mouth, xerostomia, cracks at the corners of your lips, cheilosis, bleeding gums. But keep in mind, glossitis can also come from other nutrient shortages like folate, riboflavin, or niacin. Symptom number 3, tingling, burning, or numbness. This is called paresthesia, a pins and needles or burning sensation in your hands or feet. Many people with B12 deficiency experience this due to nerve damage. Here's where it gets tricky. These sensations also happen in diabetic neuropathy, and if you have diabetes and take metformin, your risk of B12 deficiency is even higher because this medication reduces absorption. Without proper testing, B12 deficiency can be mistaken for nerve damage from diabetes, meaning you could be treating the wrong problem. Symptom number 4, depression and mood changes. B12 isn't just about the body, it deeply affects the mind. Low B12 raises homocysteine levels, which increase oxidative stress, damage brain cells, and can trigger mood disorders, depression, and even psychosis. The silver lining? Unlike some causes of depression, B12-related mood changes are often reversible with proper supplementation. Symptom number 5, memory and concentration problems, struggling to focus, forgetting things more often. In older adults, B12 deficiency can mimic dementia. But unlike Alzheimer's, this type of cognitive decline is usually treatable once B12 levels are restored. Symptom number 6, digestive upset. A shortage of B12 can throw off your digestive balance, leading to diarrhea, constipation, nausea, gas, and bloating. These symptoms can hit both kids and adults, and are often overlooked because they seem unrelated to vitamin levels. Symptom number 7, headaches and migraines. Headaches are among the most reported symptoms of B12 deficiency. Research suggests that people with higher B12 levels may be up to 80% less likely to suffer migraines. Symptom number 8, muscle weakness and cramps. Because B12 is critical for nerve and muscle communication, low levels can lead to cramps, spasms, and reduced strength. Over time, even simple movements can feel harder than they should. Symptom number 9, balance problems. Ataxia, or impaired coordination, is a neurological red flag for B12 deficiency. If you feel unsteady when walking, trip more often, or have trouble with fine motor skills, your nerves may be struggling without enough B12. Symptom number 10, erectile dysfunction in men. High homocysteine levels caused by low B12 can impair blood flow, potentially leading to erectile dysfunction. Addressing the deficiency may help restore normal function. Symptom number 11, vision disturbances. In severe cases, B12 deficiency can damage the optic nerve, leading to blurred or double vision. Fortunately, catching it early can often reverse the problem before permanent damage sets in. Vitamin B12 deficiency can be sneaky, and the symptoms can mimic other health issues. If you notice several of these signs, especially if you're older, vegetarian, pregnant, or on medications like metformin, it's worth asking your doctor for a simple blood test. The best part? Once diagnosed, treatment is often straightforward through diet, oral supplements, or B12 injections. With the right care, you can protect your energy, mood, and nervous system for years to come. So, if you've been feeling off lately, low on energy, foggy in the head, or dealing with unexplained aches, don't just write it off as getting older. Sometimes the answer is as simple as checking your vitamin levels. Your body only gets one shot at aging well, and B12 is a small nutrient that can make a big difference. Stay informed, listen to your body, and give it what it needs to keep you sharp, strong, and active for years to come. And remember, when it comes to your health, early action beats late reaction every single time. If you found this helpful, make sure to like this video, subscribe, and share it with someone who could use this information. Because good health is even better when it's shared. And I'll see you in the next video.